The topic I'll be talking about today is the question of, do Social Security benefit rules perpetuate late life economic disparities? And when I say we, I don't mean the royal we, but I mean this team of some superb current and past BU graduate students, Lei Ping Wang, who's a current PhD student who will soon be a postdoc at Vanderbilt, and Kristen Sock, who's a tenure track assistant professor at Hood College, and my colleague at Michigan, Pam Smog. But the focus today is Social Security. And Social Security has been one of the most successful programs in recent history. And so if you look at poverty rates in old age, right, that green line there, you will see that it went from about 1 in 3 older adults lived under the federal poverty line in the 1960s, and then due to Social Security expansion in the coming decades, right, in the 70s, the rate just bottomed out. It's 9.7%. So older adults today, on average, are less likely to live in poverty than certainly younger people, and they're about on par with working age older adults. So that leaves the media and some pundits to say older adults are doing just fine. We don't need to increase Social Security. We don't need to care about the economic well-being of older adults. And you see these headlines about greedy geezers, baby boomers kind of stealing from the younger generations. This is the narrative that's out there. So is the diminishing poverty rates in old age a good news story? Well, it's good news for some people. That 9.7% is an aggregated statistic, and if you break it down by other subgroups, you'll see there's vast heterogeneity. So about 3% of white married men live under the poverty line, but if you are a woman of color who lives by yourself, the poverty rate among older adults is closer to 35 to 40%. So we know that Social Security has helped bring down overall poverty rates, but it hasn't really diminished disparities. And there's been a lot written on why this is, but what I'll focus on in my very short time period here is the argument that the structure of Social Security benefits those marital status groups who are already the most advantaged. Those who are married, right, who have a long marriage, they have economic advantages, and they are in turn benefited by the structure of benefits. They get to choose their worker benefit or their spouse's, whichever is higher. If you are divorced, you don't get benefits if it was a short-term marriage. And you only get half of your spouse's benefit if it was a longer-term marriage. Likewise, widowed people are disadvantaged when they're widowed at a younger age. And we know that divorce is something that's linked to socioeconomic status. Health problems and financial problems destabilize marriages. Premature death comes to those who have fewer resources. So the groups in the greatest need are the ones who get a lower fraction of the Social Security benefits or are put in a position that they really don't get a choice between the better benefit. Again, there's a lot of intricacies here that I can talk about over drinks later, but that's really the setup here, that the structure of the benefits perpetuates marital status disparities and economic well-being. So the slides that I'll show you here, that took about 1.5 years of coding to get those 2 lovely charts there. This is based on a data set that has tracked a cohort of older adults born in 1939 through today. And so we have complete marital histories, work histories, and we constructed life histories to stratify people based on whether their marital statuses align with Social Security rules. Were you widowed prematurely? Were you divorced after a short-term marriage? Trying to figure out, were the disadvantaged categories further disadvantaged? And the one kind of surprising finding we had was that it wasn't the short-term marriages that, in the cases of divorce, that were the most disadvantaged, as we would expect. Those are the ones who don't get anything. It was the women in the long-term marriages. And so one of our takeaway messages is that for older adults who were in traditional marriages, women who stayed married a long time and who divorced, who invested their time and energy in the family, actually ended up with tremendous financial disadvantages at the end of life. There are countless policy examples that I will leave up there for you to consider, but I do think the takeaway upon my stop message appearing here is that older adults are not doing just fine, and any talk about cutting benefits needs to consider the distinctive needs of those subpopulations who are not just disadvantaged on their 65th birthday, but who have had these health and economic disadvantages going back to early life. So thank you for listening.